Good morning and welcome to the program Perspectives on Invicta 98.9. And this morning, a Tuesday morning like this, the program is sponsored by Kaduna State Ministry of Health. And our focus this morning will also be on COVID-19, where we are with it, and of course the country managing COVID-19. We all know that it's still with us. The pandemic is still ravaging, and of course, loss of lives is still on. This morning, we'll be staying with Kaduna State, what the situation is in Kaduna State, update of it. And my guest by phone this morning is Dr. Mohammed Rabiu. He is head case management pillar of COVID-19 in the state. Dr. Mohammed Rabiu, good morning and glad to have you on our show. All right,
hello.
Dr. Mohammed. Dr. Mohammed. Hello? Can you hear me, doctor? Hello, doctor?
Yes.
Can you hear me now?
Hello?
Can you hear me now, doctor?
Yes.
Okay, yeah, glad to have you. I was just giving an introduction there, and I guess this morning is Dr. Mohammed Rabiu. He's head COVID management pillar for the COVID-19 in Kaduna State. And doctor, I was just talking about what the situation is in Kaduna State, and of course we'll talk about it in Nigeria. We know that we're still with it. COVID-19 is still with us, and of course we're finding ways to see that a vaccine is produced so that we can, get rid of this pandemic that is with us. The United States of America, and that's talking about Donald Trump.
Hello, can you hear me?
I can hear you, doctor. I'm just doing the introduction. I'll come back to you.
Hello?
Can you hear me, doctor?
Okay.
Hello, doctor.
We back? Yeah.
Are you with us now? Hello, doctor?
Yes, I can hear you now. You went off momentarily.
Okay. Yeah. All right. Let's just go straight into it. COVID-19 and its management in Kaduna State. Where are we with it now? It is a day set aside for the Ministry of Health, Kaduna State, to bring us, updates on the situation in Kaduna State, and of course, we're talking about Nigeria. My guest this morning, Dr. Mohammed Rabiu, head case management pillar of COVID-19 in Kaduna State. Doctor, you are the head of COVID management, and just give us, the situation with managing COVID in Kaduna State for now.
Yes, good morning, listeners. Good morning, everybody. Managing COVID has been an uphill task, but thanks to the headship of the state and all the members of the COVID-19 response and management, we have come a long way. This thing started since March, everybody knows, and we've so far we've established various centers, and we're still establishing more. So initially it was centrally managed in Kaduna, and then we gradually spread to other areas. Right now we're centralizing the management. So it's not been an easy task, with all the belief and lack of belief of the existence of the sickness. The illness has been very mild, particularly in Nigeria and in part of the country. So quite a lot of people do not believe in it, but we still get along. We test a lot of patients. Initially, we started with getting rumors and people traveling, and then we investigate them and we test them, and then we follow their contacts, anybody who they have contact with, and we're managing them. Well, managing them has not been easy because having to put them up in an isolation center wasn't easy, and it gradually became very difficult. So we've adopted the way of managing them at home for those who are mild or who are asymptomatic. Because quite a number of our patients are asymptomatic. They do not have symptoms. They just happen to be diagnosed following being in close contact with a COVID-19 patient. So management has been very well. The government feeds everybody, takes care of the feeding and drugs and everything, and all that logistics. So we've done with quite a bit. We increased our testing. The testing capacity determines how many patients you can get. And we were able to, from initially we were taking our samples to Kaduna, Abuja. But right now we have 4 testing centers, 2 in Kaduna, 1 in Zaria, and I don't know, 3 in Kaduna actually, and 1 in Zaria. So we now test more, and we get more patients. Yes.
Well, yeah, doctor. What would you put this situation to? How would you link it up with what is happening in Nigeria or in Africa, and what is happening in other parts of the world? We're seeing a situation where, for example, in America, it's still a panicky situation there with COVID-19, and we're still getting loss of lives and all of that. But situated back home here, and in Nigeria, in Kaduna State particularly. It's coming up, the figures, and is one that can be handled. And what would you say is why we're having it so good with us here?
Yeah, well, many people have tried to give an answer to that. Considering the fact that a lot of people are dying in America, in India, in Brazil, but it's not happening here. Even as at now, we did not reach up to 1,200 cases from the beginning to now of deaths in the whole country. Even in Africa, I don't think we have many death patients. People have tried to explain reasons. Could it be environment? Could it be because we're used to some diseases like sicknesses, and we have some immunizations during our youth, which is not happening in other centers, in other parts of the world, because they do not experience those kind of sicknesses like measles, tuberculosis, malaria, So a lot of factors. If it is genetic, we have blacks in America, and blacks are dying more. So I don't think it's really genetic. But there's something more that is playing a role. And we thank God that we're really having it mild here, considering the fact that we have a much low health sector capacity compared to America. So I believe that is one reason why people a lot of people do not believe in it, and it's not an easy thing to really enforce them to distance themselves and do all sorts of infection prevention and control. So that's been a plus on our side. And we've had few deaths. Right now in Kaduna, we just had 2 deaths in the past 3, 4, 5 months. Whereby in other countries, you can have 1,000 deaths in one day.
Yeah, and let's look at the protocols on ground for us, to stick to or keep to, so that we all can be safe from COVID-19. I'm talking about face masking, social distancing, avoiding the hugs, the handshakes, yes. And of course, also, staying safe from COVID-19. What we have and what we can see, even looking around, is that we're just off our guards with these protocols, and we see the marketplaces now choked up and people, rubbing, on each other, and so while we've let off, on our guards, we're keeping ourselves with COVID-19. Your concerns here?
Yeah, my concerns are, when we started. And with the lockdown, it's not been an easy thing for a lot of our people, that some of them really have to go out to fend for food for the day. So it's really been very difficult for us, and we reach a point whereby we begin to see people are really trying to maybe revolt or something. So the government has to really gradually open up, and with that, we realize we are starting to have spikes in the incidence of cases. And we believe the people have. people do not really adhere to these rules of self distancing, using hand sanitizers and face masks. It's really been an uphill task, and that is one of the major drawbacks in managing cases and preventing infections in the state.
Are you satisfied with the level of the people coming out, with those that have symptoms of the COVID-19 coming out for testing and what we have to do after?
Actually, quite a number of them are compelled to do that. Yeah, some of them come. A few of them come because either they want to travel or they have to do something that requires the COVID-19 testing. Well, so we do still test them and we follow them up. We have resistance, especially from the interiors, the other local government away from the core, Kaduna. So it's not been easy, but so sometimes we have resistances, sometimes we even have outright challenges and attempted assaults and all that. But we still keep our front and still try to test them. And we're still getting patients. We're getting this test done, but not as much as we want, because we still have that problem. And the patients and the populace are not really doing much in terms of cooperation and spreading awareness and keeping to rules and regulations of prevention and control of this illness.
We're also having a situation, again, could that be a problem where, we do self-medication at home? Look at all the cultural people, traditional people, and have found our own medicines, for care of some ailments. We're talking about a situation where we can have malaria and, comparing it with COVID-19 and saying that we can't treat ourselves at home. Could that be a factor, about coming out for testing?
Actually, we'll have that problem. In fact, we've had some traditional medical providers that came to really want to offer help. They have alternative medicine in managing COVID. Actually, but you and I know that COVID is really a very and difficult to treat. Even in the Western world, they've not really found an tentative, definitive management protocol. So the best way of managing it and containing it is by distancing and following all those preventive measures. So I think we don't have any other way. And like you said, yes, people really tend not to come out. They do the usual sort of things, medications, supplementations, and all that. And we have that experience, and we try to educate them. But it's not easy to educate everybody. That's why you have all these people walking around without masks and all that, and try to take themselves at home. Some ask us, what should they take at home? They call us and ask, what should they take at home? Self-medication, like you said. So all this is happening out there.
Yeah, we are also looking at the situation where, coming out, the stigmatization that's involved with COVID-19. Has that been a problem too? Because again, not only stigmatization, we also hear of discrimination, all coming out with, especially victims of COVID-19.
I think that was a major problem at the beginning in the first 2 months of the pandemic. But it's going down now. People are coming out voluntarily. Before, it was even difficult for us to go and convey a patient, evacuate a patient to the isolation center. We have to really go and hide our ambulance somewhere because we don't want to be evacuated to the center because of the stigma I was talking about. But I think that is on the decline, seriously, and people are coming out voluntarily to be tested. So, because people have not found out it's not a death sentence, especially in this part of the world. So, except for some places of work that really require some form of certificate that we give them to certify that they are healed and they are okay to return to work. So there's still some form of stigma, but it's not as much as at the beginning. April, May, thereabout.
What about community transmission? That had also been an issue with, treatment of COVID and, of course, having people stay safe from COVID-19. Community transmission, are we, on top of it now?
We are deep in community transmission, especially with the opening of markets, mosques, and other places of community socialization. So it's an optic as well as we can do. We're just trying to see how we can really keep on enforcing that distancing. Because it's really difficult to do that in the market. You see how crowded the market is. Even the buses, where they say if you take 2 people, they should take 4 people, they take more. So it's really there. The thing we are praying for is for maybe we'll be able to, get used to it, because maybe this sickness will become part of us, like ordinary catarrh and malaria and other sicknesses that are being raised for decades. And thankfully, it's not really as mild as it is. But we still have some few severe cases. And quite a number of times, these people hide at home. They don't come until it's very late. The disease has gone really far, and they end up dying. These are the only people that die, actually, in this area. Yeah.
On the top board, yeah, one of the things we have on ground is having our schools opened, and of course we know now that some students have had to go back to school because of examinations that they have to write. But we're talking about pupils and students, other classes who have to go to school. For reopening of schools, what must be on ground for us to even just think about having our schools opened?
Yes, we have a part of our pillar team, especially the infection prevention control team pillar and the risk communication pillar. They have been doing a lot of work in trying to make sure the schools abide by rules we set, distancing, cleaning and wearing of masks. We started with the people and students going for exams. In fact, quite a number of them we tested, they were positive. We had to take them to isolation center where they had the exams, or isolate them in part of the school. They had to write the exams with the PPEs and everything. We assist them. So opening the school is really something we are looking forward to, but it's not an easy thing. You have seen how other countries are opening and then closing again. Yeah, so it's really another challenge that we're going to face. It's easy, but invariably people have to go back to school.
Again, I'm looking at let's look at enforcement of the laws, the guidelines for COVID-19. That has, relaxed. Some people said we do not see law enforcement agents, to really tell us that, we must do the right thing. And of course, we also know that government has, it's like we are on our own now, because government has, but we do know that even this campaign that we're having on radio is part of reminding us that COVID-19 is still with us. But the enforcement that we have about this, it has relaxed. Any consequences on this?
Yeah, you can see relaxation is really relative. We still plan to really reinforce these things. We're still enforcing these things, but it's not easy with such a large population. The enforcement it still goes with travels, border, point of entry and all that. Especially we still have our people at the airports and the bus stops and the garages, the parks and all what have you. So it's not as if maybe you're thinking about mobile calls.
Yes, all that.
Yeah, it wasn't easy. We even the lawyers, the judges, they needed to go back to work. So they really were not. It wasn't easy for them to really continue to do that mobile thing. But I think the government is still trying to do something so that you still enforce, and that's without our other hope. Preventing this sickness, illness, our only hope, honestly.
Okay. All right. Okay, doctor, we'll have to go for a commercial break. We'll join you later.
Okay, thank you.
Is the program Perspectives today, and we're looking at COVID-19, the situation that we have in the state, of course, talking about it globally. And Dr. Mohammed Rabiu, head case management pillar for COVID-19 in Kaduna State, sharing his thoughts with us. This program is sponsored by Kaduna State Ministry of Health. Well, Dr. Rabiu, we also have a situation now that people are talking about the treatment centers, worried that asking the question, is it all free, or is it one that patients would come with some form of financial implications on it, and of course what the situation is if people have to go into isolation and treatment?
Actually, the isolation is totally free. Right from testing. Testing alone costs about 20 to 25,000 to the government. It's free. And then when the patient is brought in, conveying the patient, whether it's from Malanfashi or from Bilungwari or from Kafanchan, is still free. The patient is admitted free, he doesn't pay. He's fed. Drugs is free, everything is free, investigations. Even when they are discharged, we do based on investigation, but blood tests, we take either to Baralik or Sudan, so these are also free. So nothing, the patient pays nothing practically. Even if he comes with other illnesses like diabetes or typhoid or any other thing, even surgical, we do it free for him, as long as he's a COVID patient. So everything is taken care of free. The government takes off electricity, water, everything, and then paying the workers. So really a very, very huge task on the government, and I commend it. So we'll commend them.
Okay, again, has there been an abuse of these government's lages? Has there been an abuse on it? We're talking about people, whatever is free, we know how it's been handled and things like that.
Well, no, you see, COVID is not a sickness that everyone wants to just claim or enjoy. It's just come and enjoy that. So nobody is actually willfully doing that, either on the side of the managers or on the side of the patient. I had abuse.
Well, let's also look at the management of COVID-19. People talk about having testimonials of those that have been out and certified free from COVID now, where we're not having a lot of these testimonials of people that have gone into it. How this will help too to convince people that this is real. And your thoughts on here?
Well, actually, we have testimonials. I don't know maybe the scope of these testimonials, but I was also actually a part of a team of journalists, not from the government house, actually from NCDC and some other sister TV stations and radio stations that came, and we actually went in OPPs and they took testimony of people that are actually there, and a lot of people have written on social media or other means testimonies of how they were taken care of, how grateful they are, and dispelling all rumors and a lot of negative talks on managing patients and isolation center. It's not easy to really manage so many patients at the same time. Sometimes we have our setbacks, but the government, all cadres of government parastatals are coming in to help, from Cat Pharma to Cat Gives to Cat Swag to everybody. They are also putting out. They have their DJs as members of our team. And they all try to do that.
Yeah, I'm looking at the situation. We've gone into now home management of COVID-19 now, and of course, government facilities where these are being done. But one question still remains that people would want an answer to, and that's about drugs. What are the drugs involved in these, and can people, with symptoms of it, and why keeping that away from the people or from public?
We do not want people to just self-medicate without proof of being infected with COVID-19. So the drugs, actually, they are not difficult drugs. They are drugs you can get over the counter, except the antiviral drugs, which are actually used also by HIV patients. So initially we were managing everybody with antiviral drugs so that they get healed very fast. But it's all the side effects, and then the fact that it's expensive and difficult to get, and it's depriving the HIV patients of it. So and with the NCDC guidelines, we decided to hold back on it and reserve it for only very severe and very bad patients, especially those with comorbidities like diabetes and hypertension and heart problems or kidney problems. So that the healing is well. But for asymptomatic patients, we see them walking around, they don't even know they have sickness until they were tested. We don't give them the basic ones. We don't want to say it out in public because some of them just go and buy. In fact, some people even buy it preventive, just preventive. They just take it prophylactically, so that they don't get the illness. So we don't want abuse to come in.
Okay, doctor, you're part of the frontliners, in treatment of COVID-19. Situation we had with medical, health personnel was at one time they were on high risk of 19. Are we having a situation where the personnel here, the frontliners, can also be safe now? Do we have enough facilities, to take care of our health, personnel?
Yeah, we have a quite number of healthcare personnel in front line that got infected. Fortunately for us, we are the core of the isolation centers. We, because of our awareness and the measures we take, in preventing, we've not had we had a few incidents of some gym workers that got infected, like in this center. Most of the health workers that got infected are from outside facilities. Those that they are not aware, like in general hospital, primary centers, and other secondary and tertiary centers. That patient comes in, and they think he has malaria or something, and you end up getting so that they have a higher risk of getting the infection. But we, all patients that come in here, we know them. We know their diagnosis. So we are very careful, keep our distance, and we make sure we don't we take all measures. So we've had some quite of number. In fact, we lost some. Quite a few of them. We lost one or two patients, two healthcare workers in the state. Yeah, to the COVID-19.
Are we safe at this time to say that the private facilities, health facilities, can take care of COVID-19, victims or patients now?
For now, we do not do that. We only keep them in our facilities, or even in their government facilities. We already have some holding areas or some form of isolation, pending when the patient becomes really positive or confirmed. But as time goes on, and the thing is that time is going, we have to end up decentralizing everything, and then maybe commence managing patients in other facilities. Even in private facilities, when they are in the middle criteria, they have to really have areas that you can isolate, and you have to have very good infection prevention control taught by to their workers. Because we've had a lot of incidents of getting them infected, and sometimes we close the hospital and disinfect the hospital and manage the patients.
Let's take a look at global perspectives to COVID-19. Russia had come out with its own vaccine. The world is still challenging the efficacy of this. America, with Donald Trump, has said that before the elections in November, he wants the vaccine on. Of course, the Democrats are saying, how well can they trust, this man? And so, for cure for COVID-19, the vaccine, are we in a situation where we can, come up with it before the close of the year?
Well, even yesterday I was listening to CNN. I was watching CNN, and there's this talk about this vaccine. A lot of politicization of vaccines. But vaccines takes a long, vaccines have been produced over decades and decades. But it takes a long time. You have to really make sure these patients are safe. People are safe. Those who are taking the vaccines are safe. The vaccines are safe. So it might take up to a year or even next year. So we have to just go beyond politicizing what like Donald Trump is trying to get some support or whatever. And it's in favor. So you can see the experts, CDC there, they are not really going along with him. They still insist that they have to really take their time. Even when Russia brought their own, they still, we are behind the WHO. The WHO has to really come out and give us the go ahead. But the federal government and the state government, they are all anticipating and preparing to buy these vaccines for everybody.
And back home in Nigeria, President Muhammadu Buhari had said that COVID-19 had taken its toll on Nigerians on every facet of society, economy, social dealings, and all of that, and that Nigeria now, its revenue base is being affected by COVID-19, and so looking for ways that we can cushion the effect of COVID-19 with us. But with what we have on ground in the state and in Nigeria, can we ever get back to normal? Because we are in a new normal now.
I think, we can. I think we are just adjusting to it. You can see, even we here, we know, if you look at it, consider the fact that some of us, again, we have to really, it's a new life we've developed now. It's a new life we have now. Suddenly, not doing that, it's not essential, and it's become part of us. Cleaning your hands, distancing, and all that, it become part of us. It will remain with us. And this virus is also going to remain with us. I mean, hopefully, we'll overcome its hard aspects, deadly aspects. So, I think it's taking a toll on everybody, and people are adjusting gradually. You see, people are getting along, going on. It's only we here that know that people are really getting affected. But if you go out, you see that nothing's happening. It's back to normal. Business as usual.
Okay, Dr. You just stay on the line. Time we bring in the audience to ask questions and, of course, comments that I would want you to respond to.
Okay.
Yes, to the audience out there, what is happening in your community and, your take on COVID-19, the myth, if there is anyway a myth that some people say surrounds COVID-19. Let's get to hear, from you about COVID-19 in and around us. Numbers to call to be part of the program: 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Numbers to call to be part of this program. Hello, good morning.
Hello, good morning, sir.
Good morning.
Good morning to your guest, sir.
Yeah.
Sir, I have one question to clarify, sir, because recently there was a report that somebody from 44 that was having this COVID-19. In fact, they abandoned that person after telling the relative to dig the grave. They abandoned the dead body there, and similar something happened also at Nasarawa State. I don't know why, and I don't know what action the doctor is going to take on those issues. The second one is that does this strike by doctor affect Kaduna State? If so, what measure are you taking in place? Because definitely it will bring us back instead of moving forward. Thank you, sir.
All right, that's Comrade Gabriel.
I got the first. Okay, I got the first question.
The second one is the strike by doctors. Is it
okay.
State? Yes.
Okay. The answer, the second one is that the Kaduna State doctors were not really affected by. They are not going for the strike. Even if they are going, we at the isolation center, we don't go on strike, and so everybody's around, so it's not affecting us.
Okay.
And the fourth one is you talked about 44. 44 is our partner in managing COVID patients. Actually, we have isolation there for suspects. We make use of most of these isolation centers like Barodiko, 44, Air Force Base, and other places to keep our patients. Even they are tested and they are positive, we can isolate them there. If they are not, they are okay, or we bring them to our facilities if they are symptomatic. If they are okay, they can stay at home. We do home management for them. Quite a number of them. A few of them, sometimes initially we've been having problems. Very sick people coming from other states, very sick, and they bundle them to us. Initially there was this stigma, like you said. Somebody suffering from some other illness, totally different, and being abandoned by hospitals. Eventually they end up either in 44. Sometimes they are very bad. And we've had incidences of people dying like that. They're not too due to COVID. And then maybe that can happen. But where we have people that manage COVID before, and maybe if somebody dies as a suspect, we did not know, maybe he came in very late, and we still go and confirm, and we do COVID burial, with IPC, speaking and everything. That's all I know about 44. I don't know any other incident that guy is talking about. But I know some people have died, up to about 8 or 9 or 10 of them, but most of them are suspects coming very late to 44, because 44 is helping us to keep as suspect. Managing it. So that's all I know about 44. I don't know about Nasarawa State.
All right, Doctor, we'll still have another call here.
Yeah.
Hello, good morning.
Hello, good morning.
Good morning.
Thank you. I see Modu calling from Idi Musa Mando.
All right, I see you.
Yes, pertaining the protocol of COVID-19, I think, is it not possible for the government to show example with the elite by prosecuting them in the public so that people will hearken to the protocols? Because if you see, in fact, people are no longer using face masks or nose masks. People no longer wash their hands. And people are assuming that COVID-19 is over. So, but if the government will do something by one example, with one elite, one of the political holder example with him, people will now take it seriously. I think it will help us, because if not, if our children go back to school, it is only God that will save us.
Okay, I see, Modu. All right, leadership example here. Doctor, reaction?
Yes, I think I agree with him, but fortunately for us, most of the elites abide more by the rules compared to the other ones. The elites are tend to be more educated, tend to be more scared, because they tend to be more on the elderly side. So they really try to abide. And we have admitted so many of them, directors, commissioners, many people. And we admitted them, and they really, at the end of it, they really testify that these things are real. and they take more care in doing that. I know there are some isolated cases of elites not abiding by the rules. We've had instances of elites sending their children to, and then send the children testing positive and all that, because they are elites. But they are not in the long run. I mean, overall, I think the lower class tend to be more lackadaisical about it and nonchalant about the illness. So and then that protocol, they are not abiding by that. In fact, some don't even believe in it from day one. So we have no problem from the lower cadre, lower class than the elite. But the government still does not spare anybody. We have a task force, we have a security force, and we have the judges and everybody, lawyers and the police are all behind us. If anybody tries to break this law, anyway, it can be used on him.
Okay, still with our calls. Hello, good morning.
Hello, good morning, sir.
Good morning.
Good morning, yes.
Good morning.
My name is Mike Baba from Rogo.
All right, Mike Baba, let's hear you.
It's a solution. I think it is better for the government to put out security agents to take this, not to fix a specific time. Randomly, let them come out and check. Anybody without, not adhering to this should be taken to court and be fined. This will really relieve, because now when you go out wearing this face mask, you look very odd. The majority of people are not using it. Thank you, sir.
Okay, thank you. Doctor, you got that? Mike Baba.
I got the aspect of people not wearing masks, and then that are wearing masks.
Yes, and then random checking of areas where could be susceptible to.
We know we've been doing that. We've had we have challenges sometimes. Even our ambulances are almost getting mobbed. We've been doing that contract. No, that type of testing we've been doing it, going into facilities, going into the community. It wasn't easy. In fact, there was a time we even had a mobile ambulance donated, given to us temporarily by the international body, and we went into all the local governments. Actually, it's good to do that, but I think the government still has to. We still have a law. We have a law that we can prosecute anybody who is not abiding. But it's not easy to really go into the community and really arresting everybody and prosecuting. But if one is caught wanting, there's a court. There's a law that will prosecute. The guy will be prosecuted for not abiding by that protocol of COVID-19 prevention and control.
Yeah, and just adding to that, Doctor, some of these activities, serious activities of nightlife, that some people say that these random check-ins could help, because nightlife activities for those that okay, we'll still have a call here. Hello, good morning.
Good morning, sir.
Thank you.
Yeah, it's Buba Umar.
Buba Umar.
Yes, sir. I just wanted to ask about when are we working towards post-COVID-19 or post-pandemic. Now, except since we domesticate this pandemic, we have not been talking about how we can accommodate this pandemic within our homes and how we can overcome every eventuality with regards to possible disease, and in fact how we can claim our life. And globally now it's opening up. We still talk about the threat. So when are we? There has to be at least people contributions towards this, not the officials as well. Thank you very much, sir.
Doctor, I'm sure you got that.
Yes, I agree with what he said. Actually, we see it's not easy really. If you look at the way the government has taken this thing gradually, it's not easy really to keep people in their homes for a long time. So you have to gradually, systematically, open up, and people are getting used to it. we have to, of course, manage. We have to cope with the upsurge of the infection because of community spread. But I think people are gradually getting used to it. It's becoming part of us. It's going to be gradual until maybe eventually we have vaccines. So for COVID may be long to come, maybe around the corner, but I don't think it's actually around the corner. It's likely to take some time for us to take another, maybe eventually it becomes part of us, like measles have been with us, and like malaria and all that. And people actually, people have to really contribute, not just us. So it's becoming difficult for us to really convince people. We're still doing what we can. Even the testing has reduced some considerably. Because people are some are not even willing to come and get tested.
Okay, with another call here. Hello, good morning. Good morning. Okay, we'll take another one here. Hello, good morning. Hello? Hello, good morning.
Good morning.
Yes, good morning.
This is Daniel calling from Takuri.
All right, Daniel.
What I want to know is this. It's been long that our schools have been closed down. So I want to ask the doctor, what are the daily procedure, maybe protocols that government is putting in place so that we can resume our schools?
I didn't get him well.
Well, that schools have been closed for that long, and so what are the protocols that government must put in place to have our schools?
We have almost semester. So if you continue like that, means by January it's going to be a fresh semester now.
Okay, it's also looking at the school's calendar. Yeah, so having our schools reopened.
Well, I know it's starting with the secondary school, and I think even then it was the exam. The calendar is still. They will actually release the eventual opening. We started, with the exams, and what the government did was, they had to send some infection prevention control pillar members to go and inspect the schools. Whether the schools have isolation areas where they can isolate somebody who's sick, a form of infrared, form of sanitization, and distancing, how the classes are set, all those things. And a lot of measures. The patient, the school has to satisfy the officials before it could be deemed relatively safe for students to come in. The universities are coming up later, and that's going to be another office task. So actually, that so far the government has how far it's gone. Every school is inspected. In the whole school state, they've gone to every school, both private and government, to make sure these standard precautions are available before schools are allowed to really conduct examinations.
Okay, let's just squeeze in this one. Last caller. Hello, good morning.
Good morning, sir.
Good morning.
Sir, Pastor,
Pastor.
Yes, sir.
Okay.
I want to ask the doctor a particular question concerning stigmatization.
Okay, please go ahead.
Because you had similar discussion in recent times. So from that discussion, I made to understand that COVID-19 has no cure. Now, somebody asked a question. How about those ones that are said to be cured? So the response was that it was orientation, that there is no cure in the meantime. If there is anybody you know as a victim of COVID-19, and after a short period of time, the person now comes back and starts telling that in fact he has been cured. If based on the similar discussion that was held in recent times, if such a person is being stigmatized, is it not ideal? Since we have had some similar discussion that was made in recent times.
Okay. All right, Pastor. Pastor, we got you there. Doctor.
Please, can you look? You're talking about stigmatization, right?
Yes, that some discussions have had it that COVID-19 has no cure, And again, we're coming to say that if people have been taken into isolation and treated, and they can come back free from COVID-19, are we not having, confusing? Yes.
Okay, so let's talk about the cure here. It's not the when you said it has no cure, maybe like HIV or something. Fortunately, COVID-19, the coronavirus infection has a brief time period, maximum 14 days, maybe 21 days. It doesn't stay in your body for months, like others, or years. So the cure, that means that you cannot stop it immediately when you get infected. You get treated, but you have to symptomatically manage it until it fades out, just like ordinary catarrh. Coronavirus is it belongs to the family of other viruses that cause ordinary corazal, common cold, but it has a severe form, and that is what is prevented from happening. So fortunately, it doesn't last so long in your body. You get my point?
Yeah.
It's not like you get HIV or just some hepatitis that could be in your body for years. That's not it's curable. It's not cured because you cannot stop it. It does not cure for it, but it has a short lifespan. So if you can prevent it from going into the worst components, like going into the lungs and the blood vessels and destroying and killing somebody, then that's the cure. It's self-limiting.
Okay. All right, Dr. Mohammed Rabi, we got you on that. We'd like to thank you for coming on the program this morning.
Okay, thank you.
Thank you. Well, that has been the program. Perspectives and attention and focus has been on COVID-19, its treatment, and the situation in Kaduna State. We've had Dr. Mohammed Rabiu, head case management pillar of COVID-19 in Kaduna State, with us on the program. And of course, it's a program sponsored by the Kaduna State Ministry of Health. We'll come back on a Thursday again with the situation on COVID-19. I'd like to thank Highness for connecting us with the people this morning. Wisdom, thank you for putting us in the pictures. Good morning.